You're coming down the stairs, your foot rolls, you hear that pop, and your first instinct? Ice it. Take some painkillers if the pain's too severe, and rest. A few days pass, it feels better, so you go back to your workout, and then it happens again. Same ankle, same pop. Why does it happen? Because feeling better and actually healing are not the same thing. I'm taking you to the Edgar Degas collection at the Met because I can't think of a more relevant place to talk about ankle sprains than there among these masterpieces. Degas was obsessed with the ballerina, not just their grace, but the raw physical toll of their craft. These are athletes who push their bodies and specifically their ankles to the absolute brink of exhaustion. Their art was built on the strength of a joint that we often take for granted until it pops. First, let's be clear. If you can't bear weight, if you can't move even 3 or 4 steps, if the ankle looks deformed, you need imaging. You always rule out major fractures first. But here's the problem. Even when the X-ray is normal, that doesn't mean nothing happened. X-rays show bones. They don't show ligaments, they don't show tendons, they don't show irritated nerves. And sometimes there are microscopic bone bruises. An ankle sprain is not just a twisted joint. Ligaments tear, tendons get strained, tiny blood vessels rupture, small sensory nerves become irritated. It's a multi-tissue injury. Ice and anti-inflammatory medications help with pain and swelling. They reduce inflammation temporarily. But pain relief is not tissue repair. Here's why ankle sprains are so tricky. Ligaments and tendons are white tissue, muscle is red. That color difference tells you everything. Red means rich blood supply, white means limited blood supply. The result? Muscle heals relatively fast. Ligament? Slow. Painfully slow. That's why a muscle strain can resolve in weeks, but a ligament injury can linger for months without you realizing it. And here's where most people make the mistake. 2 or 3 weeks go by, pain fades. You think I'm good. So, you start using the ankle at its full capacity. But complete ligament remodeling takes closer to 8 to 10 weeks. Pain going down just means inflammation went down. It does not mean the collagen fibers are fully restored. So what happens when you push too early? The body patches it up fast and messy. Instead of clean, elastic collagen fibers, you get scar tissue. Fibrous, stiff, less flexible. And that scar tissue thickens the area. It can press on small nerves and restrict blood flow. The joint movement becomes less adaptable. It's like a bridge that was repaired with the wrong material. It looks okay from a distance, but it can't handle the heavy traffic anymore. And that's when people say, I keep rolling the same ankle. It's fine when I walk, but the moment I run or lift, it hurts again. Or, my ankle just never felt the same ever since the sprain. That's not bad luck. That's incomplete healing. So, what's the real solution? The answer is simple in theory. Get more blood flow to the injured tissue. More blood flow means more oxygen, more nutrients, better collagen organization, and cleaner recovery. But here's the challenge. How do you increase blood flow to tissue that barely has any blood vessels? Heat helps a little, massage gets some of the way there, but neither reaches deep and precisely enough to where the ligament actually is. This is where acupuncture becomes genuinely relevant, not as an alternative, but as a physiological tool. A needle can reach exactly where the injured ligament sits and trigger an immediate local increase in blood flow, right at the tissue that needs it most. And this isn't random. The lateral ankle, where most sprains happen, is where several key acupuncture points are located. Points that sit directly over the ligament that were injured. So, the treatment targets the exact structure that's damaged. But it doesn't just treat the injured ligament. After a sprain, your nervous system goes into a kind of protective mode. The muscles around your ankle, the ones responsible for keeping it stable, can actually become neurologically inhibited. They don't fire the way they should. Small sensory nerves stay irritated. Your movement patterns shift without you even realizing it. And that's part of why the ankle never feels quite right, even after the pain is gone. Acupuncture, especially when electrical stimulation is added, helps calm that overactivated nervous system response. It's not just about pain relief, it's about restoring the muscle coordination and joint control that a sprain quietly takes away. And for cases where there's a bone bruise or a microfracture, the kind that doesn't show on a standard X-ray, circulation still matters. Bone healing depends on the environment around it, oxygens, nutrients, efficient clearance of inflammatory waste. Acupuncture supports all of that. It doesn't replace how bone heals, it creates a better condition for healing to actually happen. This isn't about tradition, it's about physiology, and the research reflects that. Multiple randomized controlled trials and meta-analyses show that when acupuncture is added to standard care for ankle sprains, patients recover faster, return to activity sooner, and demonstrate better balance and stability, not just less pain. And that distinction matters. Don't just wait for the pain to disappear, because let's be honest, what you're really afraid of isn't the pain. The pain will go away eventually. It's your ankle giving out again. It's the flare-ups every time you push yourself. It's losing that joint mobility to flex or extend. What's actually at stake here is chronic joint instability, but that is entirely preventable. The goal is to shorten recovery time and give the ligament a proper chance to heal. When you support that process early with treatment that actually reaches the tissue, you're not just recovering from this sprain. You're restoring full stability when you run or lift, full confidence when you push hard, full range of motion. And the earlier you support that process, the lower your risk of this becoming a chronic problem. That's what proper recovery looks like. Your ankle back to full capacity. I hope this tour of the Upper East Side's finest art has given you a new perspective on the art of healing. Whether you are a prima ballerina or someone just trying to get back to your morning run, the physiology of a sprain is the same. A sprained ankle isn't just a temporary setback. It's a delicate structure asking for proper restoration. Don't let a single pop turn into a chronic shadow. Your movement, your stability, your freedom, that is your own masterpiece. Let's make sure it's built to last.